Grassley, though, says that he still expects tax cuts for what they're worth by Christmas. To Virginia Republican Congressman Scott Taylor on that. Congressman, if one cynically were to read into this that it's very difficult for your colleagues in the Senate to cobble together something, I could miss something, and Mitch McConnell's a brilliant tactician and legislator, so maybe he will get an alliance going and get this done. But is there a point at which you say, all right, this is not working out? We have a better chance of getting tax cuts going and leaving the legislative year with a W. What do you think?
Well, Neil, always great to be with you, of course. And I'm an optimist by nature. I've said this many times. I think that they ultimately will get something passed in the Senate. Now, we have to respect their process, and we know, obviously, as you know, we've already done so in the House. But I think they have to. I think they have to get something done. I think that they will. I think once he gets close or believes that he's there, they'll put it on the floor and put it up for a vote and let Republicans be held accountable either way, whether they want to or not. Or we'll see what they do. But I think we have to do it. I think we have to do it before we start tax reform. Period.
Really? So there's no way to go forward without going with this in one way, shape, or form?
I don't think you're going to get a robust, let's say you don't move forward with health care reform, you're not going to get a robust tax reform either. I don't believe so. So I think it's imperative that we do it. As you know very well, I mean, the Americans are paying more tax than they have in the history of this nation, and a lot of that is due to the ACA, and American families are getting crushed under that thing. So we have to move that forward. I'm not of the mindset that we just give up. Now, obviously, you know my previous background, we never quit. I don't think we give up on that. I think that would be harmful for us as a party moving forward. We have made a lot of promises to move forward, and then I think we need to get it done, get it out there, and then work on tax reform.
Part of this measure that the Senate is considering includes keeping two very big taxes in. That is the 3.8% surtax on investment income for the rich and the Medicare tax, again, for the rich. Are you okay with that? It would be, as many of your colleagues have been saying, better than nothing, that something is better than nothing, to the Fred Barnes article today, that no matter what you say about it, it is a better alternative than what's out there.
Well, let me preface this by saying I'm a fiscal conservative. Obviously, I don't want to pay more taxes than are necessary for folks, anyone out there. I think it's important that we get this done. I'm not sure exactly how it's going to come out of the Senate, and then, of course, how we negotiate with the House and get it to the President's desk.
But could you live with that, Congressman? I apologize, but could you live with that then as a means to an end? I think that's what Mark Meadows of the House Freedom Caucus was saying, a conservative group, that look, if this paves the way to tax cuts, so be it.
That would not be my preference, but as you said, we have $900 billion worth of tax reform in health care alone. Right. So if that's what we end up with to get it done and get tax reform for the American people, then we'll see when that comes across the Senate desk and over to us. Are
you troubled, by Republicans being in this kind of trouble, that they cannot get this done? They've had 7+ years, not you, I mean, you're new to the gang there, and you were serving your country very bravely beforehand, but that it's so difficult that it's almost as if they can't handle power.
Well, no one said it was going to be easy, Neil. But no, I think that, listen, you've had Obamacare for 8 years now, so it is pervasive throughout the system. There are some good things that have come out of it, but it's fundamentally flawed, as I'm sure you've had plenty of people on your program say that. The legislative process is not a quick one. There are diverging interests, of course, from some states that expanded Medicaid, some states that did not, like my own in Virginia. You have diverging interests that you have to find that sweet spot to be able to get it passed. But I think that we can do that. I think that is our obligation to govern and to lead, and we should do that.
All right. We'll watch very closely. Congressman, thank you again. Good seeing you.
Thank you, Neil. Appreciate you.